Contents of the placards that highlighted the frustration of healthcare workers attached to government-run health facilities across the island set the tone of a silent protest on Monday. The protest comes on the heels of government not meeting their many needs, from working conditions to salary and increments. Apart from the Mungay Hospital, CC6 Newsnight also visited the compound of the General Hospital in St. George's, where nurses held placards with similar messages to those at the Mungay Hospital. Some of the placards from the Mungay Hospital read, "Mr. Still, retract your contract." "Workers can't even hold appetite. Stench from sewer, keep taking it away." "Oh God, them Chingwang sewage killing we." While those from the General Hospital read, "PW says decent work for workers." "Pension pay the retirees." "Nurses stand united." Public Relations Officer of the PW, Brian Grimes, spoke with CC6 Newsnight on completion of the first day of the protest.
The union would have made multiple efforts to iron out all these issues one by one, but what has transpired over a period of time, based on the high-handedness of our employers, the issues have piled one upon each other. So now there are a myriad of issues to address, and there is an undercurrent of frustration with our nurses as well as other public officers around the island.
Grimes says at this time nurses are the vanguard of the movement and the protest is solely their initiative.
They have taken the decision to make our employers understand what the level of frustration is, and one means of doing that is that they would have decided to do a standout for 3 hours every day for the week. Within that, there is understanding that we are a very responsible organization, so provisions have been made for anything happening as far as patients are concerned. But the nurses, they are bent on making sure that the frustration is ventilated.
The PWPRO says there have been a number of issues that the government has not addressed, and as such, there has been a pile-up.
Subsistence allowance, we know that our nurses are already underpaid, and that move further exacerbated the situation. Recently, one of the major things is contract. The nurses being employed through a private agency. When that was ventilated publicly on the government side, the union would have voiced their strong objection to this issue, right? What transpired after that? They did not communicate with us as far as how we are going to proceed, as is the normal thing to do with bilateral relations. They just unilaterally took a decision to go ahead with it.
The silent protest is expected to go for 1 week in the first instance, Grimes says, and if no solution is met, then the public can expect an escalation of industrial action. Sherry Ann Noel, CC6 Newsnight.